Well, welcome to our episode 9 of our HEST video podcast. Once again, my name is Philip Post, and I'm fortunate to serve as the Interim Associate Dean for Academics within the College of HEST, alongside my colleague, Dr. Keller. Now, it's been more than a few weeks since we've last published our last video podcast. Moving forward, we hope to continue to provide this content on a bi-weekly basis. In the meantime, hopefully you've been able to check out some of our other video content, our day in the life of one of our athletics training students. In addition to that, hopefully you've been able to enjoy and keep up to date with what's going on in the college with our HEST happenings that's sent out every Monday. And for our students, hopefully you've been able to check out our HEST Minutes, scan those QR codes that you see, check us out on the web, watch our HEST Minute, 60-second updates for our students of what's going on, fill out the form, and you get entered into a drawing to win a $50 gift card. So again, we're excited to keep all of you informed and to get feedback from our students, faculty, and staff on how we can continue to move our college forward. So in this particular episode, we continue our focus on our departments, and we're fortunate to speak with Dr. Joe Tomaka, who is a professor in public health. Dr. Tomaka has been a great colleague to me and a great mentor, particularly around developing research proposals for extramural funding, always providing great feedback to myself and I know for other junior faculty. Dr. Tomaka is an excellent scholar. He has over 60 peer-reviewed publications and over $5.5 million in extramural funding. He also serves as the graduate program coordinator in public health, and a lot of his research and funding is focused on program evaluation. He's a great resource for the public health department. He's also a great resource for our university and for our college. Dr. Tomaka was fortunate to stop by today and talk a little about the public health department.
Hi everybody, I'm Joe Tomaka from the Department of Public Health Sciences, and I've been asked to give a quick little video about our department and to answer some specific questions that I've conveniently reprinted here on the slide. Introduce myself. Well, I have a degree in psychology. That's my terminal degree is in psychology. I work in health behavior and health promotion in the Department of Public Health Sciences. I currently serve as the graduate coordinator for the department, and I've been here since 2013, which doesn't seem like a long time until I start to think about it. 2013 was a while ago. So that's who I am. We have a number of programs in public health, undergraduate and graduate. At the undergraduate level, we have a Bachelor of Public Health degree and a public health minor for people who are taking other majors. I should say that all of our degrees are accredited by CEPH, which is the Council on Education in Public Health. At the graduate level, which is where I'm the coordinator, we have by far our largest degree is the Master of Public Health degree. That's where the majority of our students are, and we have concentrations in health behavior and health promotion and health management, administration, and policy, and students choose either or one of those concentrations. We also have a dual degree program with the social work department, where students work jointly to get both their degree in MPH in public health, and then also in social work. We have a graduate certificate, which is 5 courses or 15 hours for students who want some degree of education in public health but aren't looking necessarily to major in it or get the full master's degree in it. Finally, we are also anticipating, knock on wood, a doctoral program in health equity sciences. If all goes well, we anticipate starting that program in the fall of 2022. So those are our degrees, and why should a protective student choose your programs? Well, Unless you've been asleep for the last 2 years, the nation has been enveloped in a pandemic caused by the coronavirus, and public health issues have come completely to the fore with that pandemic. Disease prevention, infectious disease prevention, those sorts of topics, chronic disease prevention as well, are key to public health and trying to preserve the health of populations. That's the distinction for public health, is we are a population-focused discipline. We are about preserving the health of everyone, not necessarily like a medical science where you're primarily concerned with the health of a single individual. We work with individuals, but always the focus is on broader health of the population or the community within which you live. So if you want to, long story short, if you want to be involved and at the forefront of these kinds of problems and issues and make your community, your neighborhood, your state, whatever level you might work on, as healthy as they can be and create opportunities for health, well, then public health is the degree for you and one you should choose. Advice for students interested in working in public health: well, have an open mind. You're going to learn about a lot of different approaches. Public health is a very interdisciplinary field, an interdisciplinary discipline. As I said, I'm a psychologist. I work with statisticians and folks who are interested in healthcare policy and epidemiologists. And we all bring our own unique set of skills to bear when it comes to public health. And you'll learn either in the bachelor's or in the master's programs or even in the certificate program how these different folks and different people from different backgrounds approach and contribute to public health. So my advice is to keep an open mind, because you're going to learn a lot of broad perspectives in public health. So, all right, I've been told to keep it to 5 minutes. I'm at 5 minutes and 14 seconds, so I will stop there. You can always contact me if you have any further questions. I'm at Tomaka, Tomaka, at nmsu.edu.
All right, well, I want to thank Dr. Tomaka for stopping by on the HEST video podcast today. I look forward to his continued contributions to the department and to our college. For all of our students, faculty, and staff, continue to check us out on social media. Make sure you check in on this HEST happenings to see what's going on in our college. And as always, if there's something that you want us to cover or highlight, please reach out to us. We'd love to cover you in an upcoming story or in one of our video podcasts. Again, follow us on social media, and I look forward to seeing you around campus.